So tell us more about Dr. William Cooper.
So I am a heart surgeon, I am a veteran, I'm an author, and I'm also an entrepreneur.
Give us a little idea about your background.
Sure, I was born, raised in a small town in southern Missouri called HIPAA, Missouri. About 3,000 people at noon on Saturday, back in the day at least. From there, I went to the University of Missouri in Kansas City, where I obtained my medical degree, as well as my undergraduate degree. I left there and went to Emory University in Atlanta, Georgia, where I did my postgraduate training in surgery, cardiovascular surgery, and subsequently a faculty position there. I later moved on to Wellstar Health Systems in Marietta, Georgia. And 2 years ago, I left to pursue some other interests that I have from an entrepreneurial perspective.
Okay, tell us more about those.
Well, Primo Health Partners was one of the things that I conceived about 3 or 4 years ago. I've always thought for a very long period of time that healthcare was my destiny, but surgery was not going to be the thing that I was going to do my entire career. I had so many other interests. I got interested in the business of healthcare. I got interested in how things logistically work in healthcare. I got very interested in educating people about health and wellness. And in addition to that, I got interested in just looking at what my own career would be like beyond my surgical career. And so that was sort of kind of the thing that, at least outwardly, that was the thing that was sort of motivating me to move in the direction of being an entrepreneur. And also wanting to make an impact on a much larger scale. I can impact and operate on one person at a time, but that's one person. I felt like I had a calling to do something much bigger and impact many more people simultaneously.
So tell me more about Primo Health Partners.
So Primo Health Partners is a telemedicine platform. It is focused primarily on offering people second opinions about their care or treatment. We have found that over time, as you have seen in the media and other places, that there's a lot of distrust, mistrust in the healthcare system. And in fact, some of that's reality. We saw in the report about the number of people who were dying late in the 1990s within the healthcare system, within hospitals, 100,000 people per year. Wow. And then now you think about the political climate in the United States and even abroad with the COVID pandemic and how people are really just wondering what's real and what's fake. And so one of the things that I thought about was how can we impact, how can we make a difference, how can we support people when they can't, in a lot of cases, go to the doctor directly, when they're having difficulty getting appointments. Doctors are getting sick, nurses are getting sick, people are getting sick. And so I saw this was a really good opportunity for me to take one concept as an entrepreneur, which was more of a healthcare staffing, and then even extend that further now to go into the digital televideo world to be able to deliver my expertise and then the expertise of other providers who may want to come and join us as we move forward.
Which reduces access as a challenge, so it must be very technologically heavy. Could you expand on that part?
Yeah, sure. It's just very interesting. The whole idea of telehealth and telemedicine is really evolved. And then the COVID pandemic really just escalated and really fueled the need to provide that type of access or this type of access to people. And so when you really think about it, doctors and healthcare institutions have been for probably the last 10 or 15 years prior to the pandemic, just trying to figure it out. Where does it fit within our normal day-to-day practice? And it was, there was a lot of people who were really very interested in it. Of course, as you know, social media and digital media, digital marketing, business-related interplay as it relates to networking and things like that has been really fueling just about everything in our economy and in our society. Mm-hmm. And so within the last few years, there have been a number of companies that have come on board now that can provide us with the platform. So we don't have to go out and organically build a system to do this. They already exist. They're compliant, they're secure, they're HIPAA certified, and all those things that, at least to the extent that we can do, to protect your personal health information.
Okay. And so who do you see Primo Health Partners benefiting most as far as a client perspective?
Well, let me tell you a little bit about what the underpinning of this for me.
Sure.
Okay. Yeah, I talked about, wanting to be an entrepreneur and all these other interests and things like that. My passion and purpose is indelibly tied to where I come from and tied to my family. As I sit here today, I'm one of 7 kids in my family, but I'm only one of 3 of those kids that are still alive and a father. So traditional family of 10, there was no baby mamas or any of that stuff. It was just mom and dad with 4 boys and 4 girls. My mom died when I was 14 years old. She was 46. She had metastatic pancreatic cancer. She was going back and forth to the doctor for about a year or so with back pain, which is a very common sign of someone with pancreatic, something that happens to people with pancreatic cancer, but it's often too late. And certainly when the diagnosis was ultimately made, it had already metastasized and she died about 6 months after that diagnosis. Now, mind you, that was really a motivating factor for me to say, okay, cool, I was already sort of into the biological sciences, loved doing the dissections, earthworms, and whatever else we did when I was in school. And so it was a natural, I had family members who were also physicians. It was a natural extension of my own interest. But that was the thing that catapulted me and said, because of course at that time, being a young, altruistic young man, I'm gonna go and save the world of cancer. Okay, my mom died, I'm gonna beat this thing. I'm gonna get back at this thing.
So that motivated and inspired you?
Absolutely, it was absolutely an inspiring thing. And then the inspiration kept coming. It kept coming over and over and over again. And I started, and if you imagine, during this period of time, I'm moving through medical school. I'm now into my residency. I am seeing the kinds of things that were affecting people right directly in my family. I'm seeing that every day as I'm going through my training and then later on in my practice. So in 1999, my youngest sister, who was the only one below me, she died 1 week after being diagnosed with diabetes. She presented to the hospital with what we call DKA, diabetic ketoacidosis. Okay. Blood sugars were in the thousands. Creates acid in the blood, and then that just sets off a cascade of events that ultimately leads to multi-organ failure, lungs, kidney, liver, heart, everything. But now it's very interesting, we go back and you think about that, just like I talked about my mom with back pain. This was a younger sister was 27 years old. You think about it, over time, she was having, she was thirsty all the time, eating ice. They call that pica, or we call that polydipsia, more formal medical term for it. Not only is that potentially a sign of anemia in young women who are menstruating and having heavy periods or whatever, but it can also be a sign of that diabetics will display. And so she was having those things. She was having frequent urinary tract infections, supposedly, and was put on antibiotics and all these other things because of the frequency of urine. She got polyuria. That's because of the blood sugar being so high. But she died literally a week after that diagnosis. But having gone and seen doctors the entire time up until then, and was never formally given a diagnosis. Now, do I blame the healthcare system? No, I don't. Could we have a much better healthcare system? Yes. Could we have a different level of personal responsibility? Yes, we can. But when you look back at that and you think about a 27-year-old young lady dying of something today that is very much so a chronic illness, it's really very, very sad. Yeah. And so another motivator, that was another motivator. It really made me started, again, being, the light bulbs are going off on my head. I'm training and doing surgery every day in my residency and trying to answer questions from the family, and they don't know what to do and I feel helpless, and it's this morass of chaos, and it seems so unnecessary, quite frankly.
So given the family examples that you just shared, and I'm sorry for your loss, does Primo Health Partners present a solution in cases like those of your mother and your sister as a solution of some sort to prevent that?
Oh, absolutely.
Okay. How so?
Absolutely. Because more so than just offering you, and I've been thinking a lot about this whole idea of giving someone a second opinion, as if a second opinion is somehow something that is unattainable or something to aspire to or something.
Seems like a luxury to some.
Yeah, it seems like a luxury. But quite frankly, many of us have that luxury because as a physician who knows other physicians, I get second opinions all day, every day. The people that I know, my friends, my network, who have my cell phone can call me every day and ask me, hey, what do you think about this? And if it's not particularly in my specialty, guess what? I know someone who does, okay? And I can do one of two things. I can send you to them directly, or I can call and ask. Or say, hey, do you know somebody who knows? Why can't we create that more formally or make that type of access available to anyone? So ultimately, although getting that second opinion, I really think probably a better way to put it, which is one of the programs that we have, is called our Health Partner Program. So we don't necessarily want to be your doctor. Okay, let's make that very clear. Because I'm sure a lot of doctors are going to say, oh, what are you trying to do, Coop? No, we're bringing a whole new concept to this. Because here's the fact of the matter is, there would be no Primo Health Partners if the healthcare system was doing everything it could to support people.
Good point. Expound on that for me.
Absolutely. In the absence of clear direction in any situation, the void will be filled by all types of, in some cases, good things, but in a lot of cases, very bad things. So if you think about this divide that exists between our healthcare providers and the systems in which they work and individuals, okay, it's now been filled by what? A morass of fad diets. The North Beach, the South Beach, the Left Beach, the Right Beach diet, the keto, the beto, the whatever you want it to be, the Mediterranean. It's been filled with a lot of information and things that really just, quite frankly, it confounds, confuses, and makes it even much more difficult for people to think about what's really right for them, okay, from a health and wellness perspective. And so what we want to be is really your partner. We want to partner with you. I want you to be able to pick up the phone, call me as your healthcare partner as it relates to cardiovascular disease. That's my specialty. I don't want to be your partner talking about GYN and all this other stuff. It's not what I do, but we want other providers to come on board who want to do that. Be your partner. I want you to be able to pick up the phone, call me, and say, hey, Coop, somebody recommended I have a stent in this artery. Or Dr. Coop, they want me to have a stent in this artery. What do you think? Okay, good. Let's look at that, okay? Let a professional who is willing to dedicate the time, spend the time to have that conversation with you, let them do what they do best, okay? Some people won't like that, and that's okay. That is just fine. But the fact of the matter is that we, by doing this, I think, can create a new paradigm and change the trajectory of people's lives.
What type of providers is Primo looking for to join the team?
Sure. Well, we're starting with the founder and CEO, Dr. Cooper, who's a cardiovascular specialist, of course. Heart surgery is what I do. But I like to say that I'm a cardiologist that operates. So, and some of my colleagues are going, oh, Cooper, you're not a cardiologist. But that's okay. So we're starting with cardiovascular medicine. That's me. We have an anesthesia pain specialist who will be working with us. We have a COVID expert, one of the internationally known COVID experts who's right here in Atlanta. We have a gastroenterologist who's also not just a gastroenterologist, but an interventional gastroenterologist. We have mental health counselors. We have pulmonologists. We have orthopedic surgeons. We have urologists. So we're kind of trying to cover all of the major specialties.
That is a wide spectrum.
Out there so that we can be as comprehensive as possible. And so we're looking for more specialists. So if you're a physician out there and you're looking for something else to do or looking to expand or whatever, come see Primo. We got a place for you as well.
Okay. Speaking of providers, how do you see Primo interacting with existing facilities such as hospitals, existing private practices, et cetera?
Yeah. So I think the telemedicine, as we talked about earlier, is still evolving. A lot of them haven't done that. We can partner with them if I see this, as we talked about earlier, as an extension of the existing relationship that patients have with those institutions. And we can be that extension for them. When your cardiologist or your urologist or kidney doctor, whatever, is not available, then we can partner with them to be that after hours person who will, in that same specialty, be able to sort of help you navigate or answer questions that perhaps your providers can't provide for you. So that's one way. For the individual provider or small group providers who want to get into the telemedicine business, I think it's a great way to expand your business. Join us. We will set up your platform. We can customize it to whatever your needs are, okay? So that's one way. Then you think about all of the independent physicians out there. I'm independent, I work for me. And so I think this is a great way to expand my base of patients and exposure, so people know, hey, Dr. Cooper does heart surgery, but you can also get to him online and either talk about your heart surgery, or if you want to travel a little bit, you can come and see him in his office, wherever he might be, and he's going to do the same great job for you. So that's an offering. And then you think about, I see so many, at this point in my career, I'm certainly in the early fourth quarter of my career, but I see so many physicians who spend an entire 20, 30 years in healthcare, and then the light begins to flicker, and they have no idea what's next. Golf is not that fun. I play golf. I mean, it's just not that fun. You can only play so much. Now, I think this beautiful earth that we have, you could probably travel for the rest of your life and not see everything that you would be just completely amazed at. So travel is a good thing, okay? But so many of them are just sitting at home.
So this could potentially give them an opportunity to continue working.
Absolutely, yes.
Maybe in a lesser capacity than they'd be accustomed to, assuming they're towards the end.
Correct.
Of their career, where they want to be winding down a little bit.
Right.
They could come alongside, get a customizable but plug and play infrastructure to be able to expand, like you said.
Absolutely. So why retire? I mean, I sent a message to my classmates the other day. I said, introducing Primo, of course. Why, same thing. Many of you are beginning to see after 30 years the light flicker. So what are you going to do? You're just going to retire and do what? I don't ever see myself, quote, retiring. I'm going to work until the last day, as long as I'm able. But I'm so curious about so many things that, I want to stay engaged. I want to stay active. And the studies have shown, people who stay engaged, who are reading, working, and all those things, they're much less likely to develop things like dementia and Alzheimer's because their brains are active and working. And so you imagine it's a major letdown. Just imagine what I do, heart surgery, to go from not doing that every day to playing golf.
Yeah, from a mental health perspective, it can certainly challenge your sense of purpose.
Absolutely.
Yeah.
And so that's one of the other things that I do personally, professionally, outside of Primo is coach young physicians and physicians who want to transition. They don't know their value. They don't know their worth. I get calls all the time. I mean, literally, yesterday, the day before, last week. Hey, Coop, what are you doing with this? What are you doing with this thing? Just curious. But I get some who are really challenged and really trying to figure out how they're going to deal with the next phase of their career. Okay.
Yeah, it sounds like you're empowering Primo subscribers to make more informed health decisions, if you want to look at it at a base level.
Absolutely, absolutely. So the data is about 1 in 6 people will pursue getting a different perspective, particularly when they have big problems, cancer, heart disease.
Something chronic.
They're going to need a transplant or something more chronic, or heart failure. They're going to really look for that's kind of the motivators, the big stuff. And yes, that can evoke a lot of emotion, a lot of questions. And I don't know about you, but I have a doctor, and I know you do too. But oftentimes, even I will go to the doctor and I say, wait a second, I forgot to address that question. I forgot to address this issue. Mm-hmm. Now, of course, I have the luxury of being able to, as another healthcare professional, phone a friend, call them back. Hey, man, what did you say? Tell me about that. Most people can't do that. You call the office, and then what happens? Maybe they'll call you back in 24 hours. But statistically, and the data and the surveys say that less than half the time you actually get that call back.
Gotcha.
And less than half the time you get that call back within a specified time. And oftentimes by then you've forgotten about it,
It's not a timely response.
Exactly, but the problem is still there. But depending upon what you read and where you get the data from, there's a lot of people who believe that, upwards of 30 to 50% of elective type surgeries, when you get a second opinion, have been deemed by the person who's giving the second opinion to be unnecessary.
Okay.
If you imagine the cost to the healthcare system of all the elective surgeries, meaning not an emergency,
procedures.
I got a lump, bump, ping, whatever here, there, I need to have that fixed. But 30% of that in a healthcare economy, that's $3 trillion. So you tell me $1 trillion a year potentially, that's hypothetical, of course, that's not the exact numbers. But I think that's very, very important. So yes, we want to partner. Yes, we want to partner. We want to help you get through that. And I also want to say that we're doing something that's very, very unique in that regard.
Okay.
We're bringing on 2 additional elements to this.
And what are those?
In addition to offering a perspective or a second opinion and also giving you or you joining us and being one of our, as a healthcare client and choosing a healthcare partner, we're also bringing in something into this platform that is often separated from other telemedicine platforms, and that's mental health. With yours truly, Tailored Wellness, as our exclusive mental health counseling provider, because I truly believe, and I think you would probably agree to some extent, that the underpinning of all of the things, these chronic conditions that we see, that we say in healthcare, 80% of this is preventable. Why? It's preventable because these are life choices that are driving chronic illnesses, diabetes, hypertension, obesity, okay, to some extent, chronic lung disease with cigarette smoking. So if you think about that, okay, if you think about that, then we're not right here and here, which is what's really driving us to do things in excess.
Right.
And so we're bringing mental health counseling for those who need it. But for those who don't, we're also bringing certified health coaches onto our platform. So if you just want to try to get right and you want somebody who is really going to focus on you, we don't work for the insurance companies. We don't take insurance, okay? We don't work for any healthcare system, okay? We work for you. We want patients, people who are having serious issues with their health and wellness, okay? Maybe not even serious issues, but who just want to focus in on that and make that a part of their life's journey. We want to be there for you. So that's what Primo Health Partners is really about.
So it's really customizable experience for each person based on their needs. If they need augmented services with mental health or with health coaching, as you said, or any of the other disciplines within healthcare.
Yes.
Sounds like you're creating a 360 wellness experience for each person.
Yes.
Okay.
Yes, that's correct. That is correct. Yes.
Okay. And when you look at some of the platforms that have been emerging over the last few years, especially growth during the pandemic, telemedicine, as you mentioned earlier, has been on the rise. How do you see Primo standing out amongst some other providers that are out there?
Yeah, so a couple of things with that. Number one is, we don't necessarily want to be your doctor, okay? We're not a typical transactional telemedicine platform. So in other words, yeah, you can make it a transaction if you want. If you have an immediate need, okay, then, and we have the expertise to address that, we will do all we can to address that for you in an immediate situation. Obviously, we're not doing emergency telemedicine, that doesn't exist.
Right.
But we want to develop a partnership. We want a relationship. This is not, I got a cough or a scratchy throat, call up the doctor, get on a telemedicine, get some antibiotics. Not really interested in that. Okay, will we move to that at some point? Maybe, okay? Will we move into getting into primary care and being more chronic disease management type? We're not really interested in that. We're looking at this from a totally different perspective. We want to hold your hand and walk you through this health and wellness journey that you're on throughout your entire life, that you can't separate yourself from. At some point in all of our lives, we're going to be affected by something from a health and wellness perspective. And clearly that has become more clear, quite frankly,
Lately.
in the last 2 years
Right.
than any other time in our history with the COVID pandemic.
Right.
And so we want to be your partner. We are different because we are looking for relationships. We're not looking for the relationship that you have with your own doctor. We want to help you navigate that. We'll help you ask the right questions, okay? We'll help you decide if whatever therapy has been proposed for you is right for you.
So really complementing any existing treatment plans that are in the works.
Absolutely, absolutely, yes. And you know, one of the things that I have found in my 30 years in healthcare is this, is that at the end of the day, and I've said this for a number of years and never really acted on it, people want to talk to doctors. I can't tell you the number of times people come to my office, they've gone to see, quote, the doctor, but then they say, oh, well, you know, I just saw the nurse practitioner or the PA, okay? But what they really want is they want that relationship with a doctor, okay? But if you really think about it, that relationship lasts about 15 to 20 minutes in an office and it's done,
Right.
until the next visit. And then who are you turned? You're turned over to the nurses and others to sort of deal with whatever it is.
So
okay?
direct access is one of the differentiators for Primo.
Absolutely, and creating that relationship. The other thing is I think telemedicine has sort of missed an opportunity to some extent. Because if you think about it, most of the telemedicine platforms are trying to basically do or mimic what happens in a doctor's office. They're trying the 8 to 4, the 9 to 5, right? Mm-hmm. And you're going to be worked into that schedule. That's exactly what's happening. No, we're saying, you know what? We want to create the relationship where it's no different than Bobby Jones texting Coop and saying, hey, Coop, I have this question or whatever. That's the kind of seamlessness and relationship that we're talking about. So we have we have the medical standard that we have to, abide by. We have to make sure it's compliant and it's protecting your information and that it's formalized so we can get online anytime with your health partner and address your issue in the right healthcare environment that's allowed on telemedicine, but we don't have to do that in a 9 to 5 and be worked into an office hours kind of thing. So that's another differentiator for us.
So the individual who's been at the office all day but's had a nagging desire to follow up on attaining a second opinion on something they've just found out about, gets home, has dinner with the family, decides to try to get some information 7:30, 8 o'clock at night. If they're a Primo subscriber, they can get that access and get a direct line to some answers.
Ping on, yes.
Okay.
Ping on. Yes.
That is a pretty big difference between every other offering out there.
We're formal. Mm-hmm. Again, you've got to go to the portal. You've got to be a patient. You've got to formalize the relationship. Mm-hmm. But we want to think about this in terms of the patient and our clients. What do they need? Okay, trying to put a square peg in a round hole, those days are over. And technology, quite frankly, is facilitating that transition for us.
Given that we're coming up on year 2 of being in the middle of a global pandemic, one, how do you think that's impacting the healthcare industry, and how does Primo approach that?
Everyone in the entire world has been affected in some way by COVID. So one of the things that, quite frankly, that really sort of was a motivator for me to escalate getting into this was COVID. Because it's so many people, I started getting more and more questions. People calling, they can't get in for this, they can't get in for that. The calls to the office increased exponentially because, hospitals shut down for, in a lot of cases, even now, just for, quote, emergency or COVID-related issues and not doing any elective surgeries. Well, those are elective surgeries on people with cancer, heart problems, lung problems, breast, you name it. They've got really some serious issues going on and they can't get in. So I think COVID also showed us that we could be a lot more efficient in how we interact with people in the healthcare environment. And then, of course, if you think about the disease state, COVID and the effect on the heart, that inflammation. The month of February is Heart Month, and you started to see some really interesting things happening with the heart. Heart attacks that perhaps wouldn't occur because of the inflammatory state created by COVID infection. You think about a term that I don't like using, but it's the one that most people feel with the so-called long haul syndrome with COVID. That's affecting the heart and lungs for a long period of time. People can't breathe, exercise intolerant, they can't exercise. You don't really know exactly why. You do all the testing and it's normal, but there's something going on that we don't understand. So COVID has had a tremendous impact on the healthcare industry. It's going to continue to have an impact for the foreseeable future.
So, Dr. Cooper, how do you see Primo coming along and helping other existing businesses?
Yeah, I think that's a great question. One of the things that I think about immediately is the fact that if you work for someone, then it's very likely you're going to have an employee-sponsored health program, right? So to some extent, that constrains your ability to make your own decisions, because that's what you've got to pick. You've got to pick one of the plans that they have, one of the health insurance plans or whatever providers that they're going to send you to, and one of the providers who's on that panel, right? So you're sort of locked into, quote, the network, all right? The way I see us being, and there's nothing wrong with that. I'm glad people have insurance and they have those choices and they have the ability to access that. But the problem still exists, okay? You can't get the appointment. You have the burning question. So we'd love to be a part of large companies' benefit package and program. Give your employees that independent source of information. We're not there to tell them no, we don't, no, we're not there to do that. We're there to help them make sound healthcare decisions, not based on what your business needs are, but based on what's good for them. Because at the end of the day, if you have a healthy workforce, and they all know this, you're going to create value for your company. And so we want to be that partner that can go into a large, small business and say, okay, we want to be that support network. We want you to have Primo as a benefit for your employees, so that they got the doctor, the specialist, when they get breast cancer or they get a heart attack or they have been offered heart surgery or a stent, or they got a gallbladder issue, colon cancer, whatever it may be, they know that they have an independent source that's not tied into that
Network.
Yeah, that network per se, or that value chain, whatever you want to call it, but is not part of that. But we can help your employee, your patient, your client make the right decision for them. Because at the end of the day, once again, a healthy workforce is going to make a healthy business, and that healthy business is going to make money, and everybody's going to be happy. We can employ more people, okay? The insurance companies are going to be just fine because it reduces unnecessary utilization of services, particularly when you think about, second opinions, 30%, unnecessary elective procedures. Insurance companies should be flocking to us to say, hey, look, we want you to look at all of this stuff. Absolutely. And those things exist, but they don't exist in a way, in my opinion, that is not biased in some way. Because who's making the decision for the insurance company? It'll be one of their medical directors. Well, they're incentivized by the insurance company. All right, let's just tell the dirty secret. They are.
Peer-to-peer review.
Right, yeah, peer-to-peer. You're gonna call the doctor and tell them no? Well, why don't you be really intellectually and professionally honest and send it outside to somebody who has nothing to do with that, but who can make a decision and help that patient make the right decision for themselves. That's what Primo is all about, and that's how we can help small and large businesses. Get us on that plan, and we're comprehensive. We have the mental health counseling, we have the health coaching. We want to partner with you, okay? We want to do those things, all right? And we want to be there and establish a relationship. We're not necessarily interested in just the transaction, because the relationship is what's going to make the difference in the long run.
And the relationship, I imagine, is what will create trust with the people you're serving.
Absolutely.
Exactly. Well, thank you, Dr. Cooper.
Well, thank you. I appreciate your time.